Hello, my name is David Wortley. I'm a Vice President of the International Society for Digital Medicine, and it's a great pleasure to be here with you today to talk about my experiences of the use of digital technologies and gamification as tools to support healthy, active aging. As I only have 15 minutes for the presentation, I'll crack straight on with it. This presentation is entitled Digital Technologies for Healthy Active Aging, and it's based on my own experiences as a practitioner and user of these kinds of technologies. So to begin with, we really face some significant challenges today, which I'm sure that you will all be familiar with. Our modern lifestyles have some interesting side effects, many of which are negative and many of which place increasing demands on resources and threaten the sustainability of health services for future generations. And these challenges are related to our lifestyle, and they result in the conditions that we're familiar with: obesity, diabetes, and subsequent problems with cancer, high risk of cancer and cardiovascular problems. And these are all related to our lifestyle. The fact that we have a sedentary lifestyle these days, we tend to eat convenience foods. When we get stressed, we comfort eat. We tend to have a lack of exercise, inadequate exercise for our needs. There is a couch potato syndrome, which means that we sit back and be entertained rather than actually joining in things. And this is also something you can regard as being the spectator society. We like to watch rather than do. So, and some of these consequences are really based on the way in which technology provides us with very easy access to our daily needs. And one of the consequences of that, I would argue, is a decline in the physical and mental challenges that we need to face if we are going to continue to develop and live a healthier lifestyle. The picture that you see on here is a picture of my mother when she was in intensive care in a hospital in Kettering. She'd been through the usual cycle of independent living and finished up in a care home where, as a result of dehydration, she became unconscious and very nearly died. And she's a classic example of the kind of process that older people get when they start to suffer from dementia and other problems. But all of these problems are related to the society that we live in today and the cognitive and physical decline. A lot of the consequences of the challenges to the sustainability of public services, public health services, are a result of the declining working population in proportion to the elderly, retired population. We're also living longer lives. And one of the consequences of the impact of technology is that as you get older, the skills that you've developed throughout your life tend to start to become obsolete in this age of technology. We're also shifting as a society from care in families to care in care homes. And with these care homes, there's a rising cost of elderly care. My partner's elderly father is due to go into a care home, and this is going to cost £1,500 per week. So it's a substantial cost burden. In addition to that, people like Eric, my partner's father, increasingly have problems related to comorbidity and a dependence on a cocktail of daily drugs. So what can we do about that? Well, the consequences of a failure to address these challenges are really unthinkable. And I would argue that there are three ways in which we try to set about solving the problem. We can develop clinical solutions that either prevent or manage these conditions. We can also influence the factors which affect our daily lifestyles, people like the food industry, and we can also encourage citizens in personal behaviour improvement through public policy interventions. And finally, and alternatively, we can develop better personal health management solutions and practices. So which of these is going to provide the best solution and who's going to provide it? Will it be health professionals, the pharmaceutical industry, drugs that we develop to solve problems, medical routines, or will it be politicians with policy decisions trying to discourage things like alcohol consumption, overeating, obesity, and the rest of it by influencing our behavior through legislation and through putting pressure onto people like the food industry? Or finally, will it be ourselves who help to provide the solution by better managing our own health by using some of the tools that are available today? So who's going to be the biggest influencer in future health? Doctors, a technology society, life coaches, politicians, pharmaceutical industry, yourself, or the food industry? Or is it going to be social media influencers and people we see within the media? But the fact is that we need to transition from a world in which we rely on cures for our problems to actual prevention. And this is something that's brought out many years ago by Sir Simon Stevens, the former head of the National Health Service, and he made it quite clear that the best chance that we've got of increasing our lifespans and improving the overall quality of our health is to adjust our own personal behaviours, and to do so as early as possible in our lives. Now, I want to use an analogy to try and illustrate an approach to tackling this problem, and that is to think of life as a journey from the cradle to the grave. Well, we all have a lifespan. We know what the starting point is, and we know what the end point is. And we also know some of the milestones along the way, starting a family, having some illness problems, becoming old, and eventually dying. So we know what the journey is, but we've no idea how long this journey is going to last, what the quality of the journey is going to be, and whether the route that we choose is going to be easy or difficult. And the fact is that it's our body, and our body is the equivalent to a car. It's our journey vehicle. It will take us from the start of our life to our final destination. And the condition of our body will depend on where we are in that journey, how long it lasts, the nature of the journey, and the quality of the life experience. And most of us don't really monitor or know enough about our bodily condition or how to properly maintain it. So I use this analogy of cars, and use the analogy to say that today, unlike older cars, today's cars tell us a lot about what's going on within the car. We can see at a glance the oil pressure, temperature, speed, range of the petrol tank, and it also warns us of any impending problems, tell us where we are, how to get to our final destination, and with sat-nav devices can compute new routes if we go off track. So this is how we use technology already. And you can compare it with the technologies that weren't available in the older cars, and the way in which they used to be very dependent on services like the AA, Automobile Association in the UK, and garages to maintain and correct problems as they arise. But these kind of technologies are not only available in cars today through wearable devices and embedded technologies. These technologies can change the dynamics of the management, like the dynamics of our car health management. So again, to use the analogy of a sat-nav, the devices that are available even today can tell us where we are on our health journey and give us an idea of where we can get to with the current condition of our body. And they provide the tools to help us to get to our chosen destination. So the approach that I adopted, and it's now something like 8 years ago that I started on this journey, not because I was suffering from poor health, far from it. I've had a very good, healthy life. But I wanted to, I was conscious that I was overweight and obese, and I was conscious of the risks to my health of obesity and other problems. So it was at a time where wearables were just starting to become available. You can see in this picture the jawbone up. And so as an expert, or being heavily involved in gamification, I decided to try and gamify my own health and set myself targets and objectives and use wearable technologies to help me to better manage my lifestyle. So I was using mobile applications, and over the last 8 years I've used a variety of devices and different mobile applications, beginning with the Jawbone up, and today I use the Fitbit alongside its applications that tell me about my sleep quality, my physical activity, and also help me to manage my diet and nutrition. And the results were very demonstrable. Within 3 months of starting out on this journey, I'd lost 21 kilos. So I'd gone from the character that you see on the left of the screen to the character in September 2013. And since then I have put on weight, but I know now how I can make substantial improvements in my own physical and mental health, and I know the recipe for success. But the thing is, how are we going to be able to influence lifestyle behaviors in the general population, where people have lots of different circumstances and lots of different personality traits that affect how effective gamification and wearable technologies might be? So the solution that I suggest is that we can use personalized, gamified and validated, importantly, behavioral change. And we can use technology to do that if we understand what the key health and well-being influences are. Now, shown this list: diet, exercise, hydration, sleep, mindfulness and stress management, and importantly, social support and a network to help you to maintain the activities that lead to good health and well-being. So the steps involved is, we first of all, if we're going to use gamification and wearable technology, we need to be able to measure these key influences. We need to use those to create our own personal benchmarks, which were different for everyone. We need to set achievable goals. It's no good setting a target of 10,000 steps today if your lifestyle and your condition prevents you from doing that. It will just be a demotivator. You also need to build a supporting environment with friends and family and other people to support you. You need to have the necessary technologies to not only help you on this journey, but to give you some kind of therapies as well. And you need to encourage personal responsibility and empowerment. So digital therapeutics really are, in my opinion anyway, you can split into two. First is the kind of technologies that influence our behaviors and help us to make informed health decisions. And secondly, the technologies which can actually deliver therapies as an alternative to drugs. And I've used both, and I'm involved in supporting and helping to develop solutions in both areas. So to express it, what I'm thinking about is a personalized, gamified and validated health ecosystem, which consists of solutions which help to diagnose, benchmark and provide interventions that are personalized and revolve around preventative healthcare. And support this, we need a network of health and well-being service providers, all singing from the same hymn sheet. So after COVID-19, what happens now? Well, I would argue that our biggest challenge is we need to change our thinking and think of the elderly as an asset, not a liability. We need to think about how they can contribute to society and help them to feel valued, help them to capture their own life memories and share those with future generations. If we make the elderly people an integrated part of our society, a valued part of our society, we, I think, will help to overcome some of the problems of a healthy, active, aging society. So thank you very much for joining me today. I hope you found the presentation useful. If there's an opportunity to ask questions, I plan to be available to answer that. So thank you to the organisers for the opportunity to speak to you, and I wish you